You walk into a hospital, and you brace yourself. You know the bill is coming. You've heard the stories: a Band-Aid that costs $40, an ambulance ride that costs more than your rent. So your guard goes up. Then you walk into a pharmacy chain. CVS, Walgreens. You grab some vitamins. Pick up a prescription. Maybe a bag of chips on the way out. It feels harmless. Almost friendly. Here's what doesn't add up. Right now, one of these two businesses loses money every single time you fill a prescription. It isn't the hospital. Walgreens' pharmacy counter, the actual job of selling you medicine, is now unprofitable. Every pill they hand you makes the company poorer. Meanwhile, the hospital you're scared of walking into? One of the most reliably profitable businesses in America. So the pharmacy is losing money doing the one thing you thought it did for a living. And the hospital is thriving off the thing you assumed was charity. Where is the money actually going? Because it's going somewhere. It always does. Let's start with what it takes to open the doors. A pharmacy store is almost insultingly easy to launch. Lease a box. Get a license. Stock the shelves. Open. That's how CVS and Walgreens carpeted the country: 9,000 stores, 10,000 stores, a pharmacy on nearly every corner. It looked unstoppable. A hospital is the opposite story entirely. Hundreds of millions in construction. Government permission just to exist, in some states. Specialists who train for a decade. Equipment worth more than most houses. By every measure, hospitals should be the harder business to profit from. For years, that's exactly what everyone assumed. Hospitals, slow, bureaucratic, barely profitable. Pharmacy chains, lean machines printing cash off toothpaste and cough syrup. That assumption is about to fall apart. Here's the number that shouldn't be possible. A few years ago, CVS made solid money on every prescription it filled. Then that margin started shrinking. Quarter after quarter. Walgreens' pharmacy business didn't just shrink. It went negative. They are now paying, out of their own pocket, for the privilege of giving you your medication. Everything changes here. If the pharmacy itself is bleeding cash, then every CVS and Walgreens you've ever walked into isn't what's keeping the company alive. The candy aisle isn't doing it. The greeting cards aren't doing it. Something else is carrying the entire business. And what almost nobody realizes: that something has been sitting in the company's own name the whole time. You've probably never once thought about it. CVS doesn't just own pharmacies. CVS owns Caremark, one of 3 companies in America that decides which drugs your insurance actually pays for, and how much everyone in that chain gets paid to make it happen. Sit with that for a second. CVS owns the store where you buy the drug. CVS owns the middleman who negotiates the price of that drug before it reaches the store. In some cases, CVS is negotiating with itself. The pharmacy, the part bleeding money on every single prescription, isn't the business. Pause. The pharmacy is the bait. But that's only half the story. Because hospitals are running an almost identical con. Just wearing a different costume. 1856. A bishop and 4 Catholic nuns open a single room. 4 beds. They call it Providence. $1 a night. Couldn't pay. You didn't pay. That was the whole mission. Charity. No exceptions. Fast forward to today. Providence is a 51-hospital system. $27 billion a year in revenue. And because it never gave up its nonprofit status, the government exempts it from over $1 billion in taxes annually. Because on paper, it's still doing exactly what those 4 nuns set out to do. Here's where it gets uncomfortable. Investigators found Providence paid McKinsey $45 million, not for medicine. For a program. They called it RevUp. Its job wasn't charity. It was the opposite. It trained staff to spot patients who legally qualified for free care, and instead of granting it, pushed them into payment plans. Threats. Debt collectors. Tens of thousands of low-income patients were billed for care they were legally owed for free. That should have stayed buried. It didn't. A state investigation cracked it open. In 2024, Providence agreed to pay $158 million back, refunds and forgiven debt for nearly 100,000 patients. A hospital founded on the promise of never turning anyone away had quietly built a machine, engineered by one of the most expensive consulting firms on earth, to do exactly that, while legally remaining a charity the entire time. That's the hospital's real trick. Not the $40 aspirin everyone talks about. That's a distraction. The real money lives in the gap between what a nonprofit hospital is legally required to give away and what it can quietly claw back before anyone notices. Two industries. Two disguises. One dressed as a drugstore. One dressed as a church. But here's the twist that changes everything. One of these businesses is currently dying. And it's not the one you'd expect. While hospitals were perfecting this game, one pharmacy chain ran out of road completely. Its collapse shows you exactly what happens when a company has no second business to hide behind. 1962, a discount store in Scranton, Pennsylvania becomes Rite Aid. For decades, it stands as the third giant of American pharmacy, right beside CVS and Walgreens. Then comes the accusation that ends it. Federal investigators alleged that between 2014 and 2019, Rite Aid pharmacists filled hundreds of thousands of opioid prescriptions they should have flagged. Oxycodone, fentanyl. Red flags, allegedly ignored, even deleted. More than 1,000 lawsuits pile up. In the months before the reckoning, the company loses over $1 billion. Its stock collapses 90%. The entire company becomes worth less than a single Manhattan apartment building. October 2023. Rite Aid files for bankruptcy. Hundreds of stores close. $2 billion in debt gets wiped out. A year later, it walks out of Chapter 11 with a fresh war chest. Everyone says the worst is over. It isn't. By 2025, still bleeding, still down to half its former size, Rite Aid files for bankruptcy again. This time, there's no recovery plan. Just liquidation. Every remaining store sold off in pieces to CVS, Walgreens, Kroger, Albertsons. 63 years of business. Gone, because there was nothing behind the counter to catch the company when the counter stopped making money. No PBM. No insurance arm. No hidden second business wearing the storefront as a mask. Just a pharmacy. The one part of this entire industry that doesn't make money on its own anymore. So here's where it should be simple. Hospitals, protected, profitable, untouchable even when caught red-handed. HCA Healthcare, the largest for-profit hospital operator in the country, pulled in more revenue in 2025 than Netflix. Then Uber. Then Starbucks. Its profit jumped almost 18% in a single year. Pharmacy chains, hollowed out. One already dead. The other surviving only by quietly becoming something other than a pharmacy. Case closed. Hospital wins. Except it's not that simple. At this point, you'd expect hospitals to be untouchable. But the opposite is happening, quietly, underneath the headline numbers. Hospital margins nationwide just fell 5% in a single year. Labor costs are climbing. Medicaid cuts are already scheduled. Even HCA's own margin slipped quarter over quarter. The empire that looks unshakable is already cracking. Just slower. And better hidden than Rite Aid's ever was. So which one is actually built to last? The business getting away with it at scale? Or the business that already ran out of places to hide? Here's the answer. And it's not the one either side wants to hear. The hospital wins. Not because it's the better business. It wins because it learned something the pharmacy chains never did. Never let the public see the whole machine at once. Split it into the hospital that treats you and the nonprofit that's technically not allowed to profit. By the time anyone connects those back into one balance sheet, you've already banked a decade of tax exemptions. and only had to hand back a fraction. CVS tried building the same kind of shield. Pharmacy. PBM. An insurance company bolted on for good measure. It's cracking anyway. Because nobody can pretend a drugstore chain answering to shareholders is a public good. When CVS wobbles, there's no goodwill to hide behind. Just a credit rating one notch from junk. Rite Aid had no shield at all. Just a counter. Exposed. The first to fall. The real money was never at the register. It was never in the hospital bed. It was in whichever business found a way to make its most profitable decisions invisible. And right now, nobody builds invisible quite like a hospital that still calls itself a charity. You walked in afraid of the hospital bill and relaxed around the pharmacy aisle. But the pharmacy was the one running out of oxygen the entire time. And the hospital? It never even had to hide the body. Because on paper, it was never a business to begin with.